here I am.
This doctor has come face to face with the horrors of the coronavirus.
Quite tired, just reviewed 30 patients.
On a front line where Dr. Rony Berrebi's been battling to keep his patients alive from a merciless enemy.
The magnitude of patient we have to deal with, it will be like having two devastating terrorist attacks twice a day on the hospital doorstep every day for weeks, maybe months. That's how brutal COVID is.
And he's facing its brutality here at the intensive care unit at London's Northwick Park Hospital. The first to be hardest hit, and now its trust has the UK's second highest number of deaths.
You've got a sense of being powerless when you see that sheer number of patients and how sick they are. COVID-19 penetrates through your upper airway and then goes really deep in your lung. And the feeling you get is very close to drowning. It's very distressing. You can't breathe anymore.
The situation was so acute, nurses and doctors from across the hospital were drafted in.
We're used to dealing with death, but nurses, for instance, who would only see outpatients, death is not part of their daily routine at all. Some of them have never seen anyone die. It was so overwhelming.
He fears the mental and emotional scars will never fully heal, in patients and in staff.
I've seen so many of our nursing staff, junior doctors, in tears after a shift. It's the fright, it's being afraid of catching it. The thing is seeing some of our people getting extremely sick or even worse, wearing the PPEs for hours on end. And if you add on top of that working nights, sometimes you do like 2-3 nights in a row, so you're sleep deprived.
Are you scared when you go to work?
I am worried. I've got my 3-year-old boy at home. What if I get unlucky? My son means everything to me, and I can't imagine not being there.
Superheroes on the fast lanes.
One way he copes is through music. He hopes this song he wrote and recorded will raise money to create the first mental health charity for health workers.
It does feel like going at war, because you fight the enemy the best you can and you can't refuse. That's a duty, and you will put your life on the line. We don't have the choice, because people will die if we don't show up. That's the profession that we've chosen. That's the profession that we love.
Dr. Rony's still working, still saving lives at Northwick Park Hospital, and trying to safeguard the mental health of his colleagues too. Sejal Karia, News at 10.